Have a nice day. I am Basheer Marzoog, a six-year medical school student at National Research Mordovia State University. My topic is the instrumental and laboratory changes in post-myocardial infarction changes. About this topic, myocardial infarction remains one of the leading causes of death globally, and according to the World Health Organization, there is approximately half billion people that are suffering from cardiovascular diseases annually, and there is approximately 18 million deaths annually. Therefore, we try to evaluate the post-myocardial infarction change and try to determine the prognosis of these patients and the risk factors for the development of the myocardial infarction and the complication after the myocardial infarction. The materials and methods we studied 154 patients, evaluated more than 70 parameters. For this, we use the student test, the pricing correlation coefficient, and the ROC analysis to determine the cut point for determination the exact age between the male and female where they got myocardial infarction. For these purposes, we use the statistical program 12 version. The results showed that there is approximately 67% of the sample of the participants they are males and 33% they are females. The cut point, according to the ROC analysis, which is very high specificity and sensitivity, that the age is 67, where the males are affected in early period in less than 67 years. And this is an important parameter, shows for us that the females are getting the myocardial infarction usually after the 67 years old. The next, it is the concomitant diseases. In the first place, we see that there is approximately 90% of the patients myocardial infarction in the sample. They are having hypertension, which is the most commonly risk factor for development of myocardial infarction, according to that. The next place, it is the chronic heart failure, which is approximately in 30% of the sample they have a chronic heart failure, and in the third place it is the diabetes mellitus and dyslipidemia, which are they are collect of the metabolic syndrome. The complication after the myocardial infarction we see in the first place the chronic heart failure. Again, interestingly, this is because the majority of these patients, they either worsen the early chronic heart failure or developed chronic heart failure after the myocardial infarction. In the second place, we see the arrhythmia, which is present approximately in 35% of the post-myocardial infarction victims. The third place, it is infarct, which is quite frequently reported in the study, and it is approximately more than 30%. Aneurysm and pericarditis, the aneurysm, it is a classical early post-myocardial infarction complication, and the pericarditis, pneumonitis, and the pleuritis, which is not present at all. It is a late complication of myocardial infarction as a Dressler syndrome. The next, we have seen the dynamic of the analysis. We see in the first day the LDH and the third day, and the same for the creatine phosphokinase, the MP fraction. We see in both analysis, we see improvement in the results according to the treatment regime. If we look for the fibrinogen is very high, 3000, and this is suggesting the hypercoagulability syndrome, and they have a high risk for the thrombosis and the stroke. And for this, there is an indication for giving this patient an anticoagulant. If we look on the CBC, we see no particular change. The hemoglobin, the white blood cell, the red blood cell, lymphocyte, thrombocytes, all are in the normal range. If we look to the hemodynamic, the heart rate, the systolic and diastolic blood pressure, we see the systolic blood pressure is approximately on the upper border of the high normal. It is 139.57, which is can be considered as a first degree hypertension if we look for it. The instrumental results, if we look for the echo, we can see that the end-diastolic volume in milliliters is approximately 134, which is in more than 95% of the sample. The ejection fraction is 54 according to the European guidelines of the cardiology guidelines. They are suggesting that 54 it is as a preserved ejection fraction, and we need to check another criteria for diagnosing the heart failure. The left ventricular size it is 52 millimeters, and the left atrium size it is 40 millimeters, the right atrium size 35, the aorta diameter and the valsalva sinus it is 35 millimeter. The right ventricular size it is 26 millimeter. If we look on the electrolytes, we see hyperkalemia and a decrease in the calcium level, which are suggested according to the myocardial infarction change because the damage to the kidney and releasing for the potassium and also damage to the myocardial size. If we look to the inflammatory parameters, ESR and the urine analysis, the ESR is high, it is 19, and it is high if we consider for the males and females, it is high. There is ketonuria, proteinuria, and leukocyturia. Also, there is an increase more than 2, which is the upper limit of the normal level for the leukocytes. And the epithelial cells also it is the normal limit less than 2 in the field of the vision. If we look to the biochemical and the coagulogram, we see the total bilirubin is high. The ALT is mildly elevated, which is indication of hepatic toxicity after the myocardial infarction. The AST it is also elevated, non-specific, and the total cholesterol. The total cholesterol is mildly elevated. If we look to the component, the LDL and triglycerides, they are high, very high. The creatinine is elevated, the urea is high, the glucose is high, so we see the renal injury and we see the hepatic intoxication post-myocardial infarction. The proportional correlation between the ejection fraction and left ventricle, we see increase in the ejection fraction is associated with left ventricular size and decrease. So if we see hypertrophy, we see the decrease in the ejection fraction. If there is hypertrophy of the left ventricle, the ejection fraction is reduced, which is a logical correlation between the ejection fraction and left ventricular size. In conclusion, we can say that systemic manifestations include kidney function impairment or development of a new kidney disease, acute renal injury maybe. And the higher the troponin level, the lower the ejection fraction and the fewer further sequelae. With age, the level of the dimer and the thrombocytes increases, which is logical that elderly people they have a high level of the D-dimer and the thrombocytes it is usually associated with the infections and the inflammations, and this is usually for these reasons these patients the elderly people they are prescribed anticoagulants such as acetylsalicylic acid. The increase in the aorta basement at the valsalva sinus it is also an increase in the right ventricular size is also have seen in the post-myocardial infarction patients. A decrease in the level of serum red blood cells, the serum potassium and the serum calcium, with an increase in myoglobin, which is a marker of the myocardiocytes or only the muscle tissue damage because it is non-specific. The females they are usually suffering from urinary tract infection in post myocardial infarction and appreciate your time and thank you for attention. See you.